Hello, my name's John. I'm a family physician in Grand Junction, Colorado. I had a patient who was very depressed. I don't think he realized it because he was having a lot of somatization. He kept coming in with a lot of physical complaints and, you know, and a lot of anxiety and insomnia. And it was pretty clear that, that he had some psychological issues, some trauma. And I encouraged him to bring his wife to one of the appointments and introduce the idea, which I had on several occasions, that maybe a lot of his physical complaints had, a basis in maybe some anxiety or depression. And he agreed, and we talked about, hey, would it be okay if I had a professional, a friend of mine, come and visit with you? And he agreed, and one of the counselors came right over, and it was amazing. And she started doing weekly sessions. We also had case management involved with this patient, and she was, this our case manager was calling him every day, and he kind of escalated, got in a crisis, and was referred over to the mental health hospital. Unfortunately, the only way to access that hospital still is through the emergency room, which I think it's a scary place for patients to go. And it's not really geared for mental health. And I think that the experience was traumatic for him. Um, and then he was hospitalized. It was, I think, the unintended consequences of some of our healthcare laws, like HIPAA, is that it's really hard for even providers to get access to information about mental health. So I'm calling the mental health hospital, and they didn't have a release, and they couldn't talk to me, and they couldn't find someone. And the psychologist over here was doing that. And I got to say, it was a really uncomfortable place for me to be. It was an uncomfortable place for our therapist to be. And it just reminded me of how bad our mental health system really is. And, he got out of he was released, and we had contact with him, but he didn't do well, and he committed suicide. And there's nobody who was at fault. I mean, the clinicians at the hospital did all they could, and I think we did all we could. Of course, felt awful and guilty that we should have done more, and so although I'm excited about a lot of the things that we're doing with the ACT grant, and I think that it's going to help people a lot. I mean, I still have concerns about the very neediest in the population who have to go through these kinds of things.